Good morning, everyone. Thank you so much for joining our meeting today. I and my colleague, Dr. Shellhouse, are very excited to be able to introduce UHS to you all and discuss how we are here to support your students' journey and their health and well-being during their time here at University of Michigan. Just to introduce myself first, I'm Amy Maslick. I'm a family physician and I run the primary care services here. Jason, do you want to introduce yourself?
Good morning. It's a real privilege to have the opportunity to talk with you today. I am one of the physicians at University Health Service. I do internal medicine, sports medicine, and I oversee our immunization and travel clinic.
Thank you, Jason. So Dr. Shellhouse will be answering all of your chat questions, so feel free to enter them as they occur to you, and I will be doing the presentation today. So first off, just to get ourselves in the right frame of mind and thinking about what questions you might have, what is your biggest health and well-being concern for your student this year? Are you concerned about COVID? Are you thinking about alcohol or drugs? Anything else on this list, maybe squirrel bites or something else that we have not put here on this list? And all of these things we do see here at UHS, and we are prepared to take care of all of these needs and anything else that students come to us with. Okay, so starting off, we will be first just telling you where we're at. So UHS is across from the Michigan League and also conveniently located on Central Campus near the CC Little bus stop. So very conveniently located for students to come to meet us in between classes before and after them. So what do we do here at UHS? Our services are constructed in a way to be able to take care of students' needs at the level of treating illness, so tertiary prevention, but also looking at secondary prevention, looking to find that disease and even further upstream and prevent it in the first place. So we really take care of our students' health and well-being at every stage. The National College Health Assessment is a way for us to frame our services and make sure that we're meeting our students' needs and addressing any impediments to academic success. So you can see here on this graph the major impediments that students have listed at our last survey in 2020. Mental health is a major concern, stress, sleep issues, also menstrual related issues, illnesses, and also eating disorders. This is our campus model of well-being. Our mission is about promoting and protecting the health and well-being of our students. We care and are passionate about our students' well-being in all manners, whether it be physical, emotional, mental, or any of these other dimensions of wellness. So we therefore really make sure that our services meet all of these needs and that have the maximal impact to our students' health and well-being. So what do we have? We are incredibly fortunate to have all of these services under one roof. Primary care serves any of students' general medical needs. We also have a very active gynecology and sexual health clinic, psychiatry, eye care, allergy, physical therapy, an eye shop for contacts and eyeglasses, dermatology, sports medicine, nutrition, social work and care management, sleep medicine, eating and body image concerns clinic, and also travel medicine. So it's not many places that can have all of these services under one roof, and we are in this way able to meet the vast majority of our students' health needs. Our staffing is here. We have all board certified physicians as well as advanced practice professionals, nurse practitioners, and physician assistants. We are also supported by nurses, social workers, medical assistants, optometrists, dietitians, and physical therapists. So we are incredibly lucky to have a very large team of professionals to take care of our students. We also have complex care teams that are listed here. One major thing that I encourage for all of our students is that they establish care with a clinician. So all of our profiles are on our UHS website, so students can get to know a little bit about us and then schedule an appointment where they can meet us and make sure that we can meet their needs and that they'll feel comfortable with us taking care of their health. I tell parents that think about UHS as your primary care doctor from home. So all of the things that you can see your home doctor for, we can see here. And then as I showed in the previous slide, we have so many specialists to take care of our students' needs that cannot be met in primary care. We are also incredibly lucky to have a lab, our own pharmacy, and also radiology to do ultrasounds and also x-rays. So COVID-19 deserves its own slide. Obviously, it's had a large impact on the way we do our services. Just some highlights for you. We take care of prevention in the form of providing vaccination against COVID and also flu, which we have seen co-infections and obviously have a lot of overlap in their symptoms. We also help to coordinate campus surveillance testing for any student who is concerned and wants testing for any reason. We take care of any students with COVID needs, both in person as well as telehealth visits, but also indirectly if they have portal messages or phone calls to discuss concerns related to COVID. Our nursing team is incredibly prepared to be able to support these services, answer a lot of questions, coordinate with isolation housing, and help support any needs related to COVID. We also have a very cool service called MPOTA, which is a text messaging system. So any student who has been diagnosed with COVID can receive check-in messages and respond to them, which will trigger our team to reach out and address whatever need they might be reporting. Our social work team also helps us support this. We understand that COVID infection can be very disruptive to a student's well-being and all of their other activities, and sometimes they need extra support, and our social work team is there for them. Mental health has been all the more important during the pandemic and has always been one of our core services here. And as you can see from this diagram, we have comprehensive services to address students' needs and really meet them where they're at. So in primary care, we can take care of many students' needs, anxiety or depression, insomnia, ADHD, for example. We also have a psychiatry team to consult whenever cases are more complex, a care management team to help coordinate care whenever a student is being seen by different services. We also have other mental health services like our eating and body image concerns clinic, our sleep medicine clinic, the counseling and psychological services. Those are our partners. They have a large number of therapists to address students' non-prescription medication needs. Wellness coaching is provided through Wolverine Wellness, and I'll talk about that a little bit further. So all of these services here are really, again, designed to be able to meet our students' varying needs related to their mental health. We also partner with our off-campus partners, so those can be in the community services or with other Ann Arbor providers, and also your home providers, because sometimes they already have an established specialist at home and they really just need us to help support them and be their partner here at University of Michigan. Okay, so how to get care here and what do we do? If students are unsure, and that can often be the case because we know this is the first time that they're taking care of their own health, then they can just call and get advice. So day or night, we are available to them. If they call this number listed here and select the nurse advice prompt, then they can talk with one of our nurses to get advice. And often that's all they need. Maybe they need to know the dosage of ibuprofen. They want to make sure that they don't need to come in for a visit. We can help with all of those. And this hyperlink here, the health topics A through Z, is also something that's very helpful. We are very familiar with the most common health needs and questions that students may come with. And so we've designed this page to really have a lot of helpful information that gives them the medical knowledge that they were seeking to be able to take care of themselves. So we do invite and encourage students to take a look here. Of course, some things the student needs to have an appointment, and so again, they can call our number. They also have other ways to make appointments. So we have self-scheduling available for certain services, including well woman exams, so their health maintenance exams, their eye visits, and also COVID testing. So really great service that we're fortunate to provide. They can also send a request through the patient portal. And this is another item I might star for yourself or take note of. The patient portal is incredibly powerful to connect students to us here at UHS, whether it be sending a request to schedule an appointment or sending a question to follow up on lab results, taking a look at their lab or x-ray results, looking at their notes after the visit to review any instructions that were provided. So the patient portal, again, is very helpful, and I would highly encourage your student to sign up. It takes truly only 1 minute to be able to create a portal account. In a medical emergency, they still need to call 911 or go to the closest emergency department, which is about 10 minutes away. So please make note for your students that if they are having a medical emergency, coming here would cause a delay. So if they're not sure, they can call for advice, but if they do know that this is something that needs immediate care, especially also on the weekends after hours or during the weekday after our clinic is closed, this is an important service that they need to remember we have here locally as well. Okay, so costs are always an important question to go over. So we have a health service fee that's built into your tuition. And so that service fee covers a large amount of our services. Our health promotion services, which is Wolverine Wellness, and I'll review in a few slides, and subsidizes a lot of the care that students have here if it's not covered by their own health insurance. So the services that you can think about as covered by the health service fee or free are most of our clinic visits, including our specialists, any nurse advice, wellness coaching, and also the first visit through physical therapy. Okay, so costs are also billed to insurance, so students can not only rely on their health service fee. So some of the things that they have to think about and why it's really important that they have their own insurance are that medications are not covered, immunizations, any medical equipment or devices, labs except for our STI testing, radiology services. So the things listed here are common medical services that we provide to students, and that they will receive a bill for their insurance. If students are in between semesters, but here locally, or maybe they're in their first year after graduation and have not yet transitioned to their next plan, then they can purchase a prepaid plan that allows them to continue to access UHS. One final note, Michigan Medicine is the hospital system that is our partner, but is also not part of us, and we are not part of them. So many people are familiar with Michigan Medicine. Just to understand that any services provided at Michigan Medicine are not covered by the health service fee because they are not part of the same organization. Okay, confidentiality is also important to spend a little bit of time on. Any students who are 18 years and older by law are entitled to confidentiality for services. Also, this includes any emancipated minors. So we cannot release any medical information, even to parents, without a consent form. Now, if students sign a consent form, then we are absolutely allowed to discuss their medical care with their parents. And the vast majority of the time, students provide this. So this is just something that we do encourage. If you want to be or know you need to be more involved with your students' care, to please have them sign a consent form before they are coming here, or as soon as they establish care, so that there are no barriers to us being able to communicate about their health. If your student is a minor, you will need to sign a consent to treatment form. And then, of course, we'll be able to have access to any of their medical information, with the exception of the things listed here. So things related to sexual health, substance abuse, or mental health. Okay, moving on to Wolverine Wellness. This is the health promotion arm of UHS. So a lot of our students are coming to us healthy or with very few medical issues. And this is the hope that we can continue to keep it that way. And so Wolverine Wellness does a lot of the outreach work on campus to reach students in different areas and to address all of these dimensions of well-being. So they have many, many services to meet individual needs. They also have group services that can also meet some of these needs. So they have a collegiate recovery program, wellness coaching to meet different needs of students and really help them to meet their own health goals. They do a lot of the communication for us. So any different health campaigns, alcohol and drug use, which is something that we are very vigilant about as students transition into college, to be able to educate them on how to keep themselves healthy. They have a lot of online resources as well, and always popular free giveaways. Okay, so some take-home points and to-dos. This is also a slide, and you will be able to get these slides by the end of the week. So I would focus on this one here. It is not required for students to have a physical exam before they come to UHS, but if they have not seen their home provider recently, this is something that can be very valuable to make sure that they are up to date on any of their immunizations. And we listed off some of the really big heavy hitters that are important. So COVID, obviously, flu, meningitis, HPV, MMR, hepatitis, and tetanus. All of those come up very regularly. And so it's important to make sure that they're protected. Seeing their home provider before they come here can also be a way to make sure that students are up to date on their prescriptions. They're not thinking about establishing with a new provider when they come here. They're thinking about really getting themselves situated on campus. And so by coming here with at least a 3-month supply of medications, this gives them the time to get settled in and then establish here with one of our providers to take care of any of their health needs on campus. This is also a way to make sure your student knows their health history. So if there is complexity, it is very helpful if the home provider can provide a letter or a 1-page summary that just goes over any of their medical needs and allows us to have that continuity to make sure that we're providing the same high quality care that students are getting from their home doc. They can get that here too. Along with that, again, scheduling a first appointment with us in the first month would be a way to make sure that there are no gaps in care and that we are already knowledgeable to take care of any needs that might come up. This hyperlink here in item number 4 is a list of different medical supplies that you can send with your student to make sure that they're prepared. So the things that I would suggest would be some way to treat pain and lower temperature. So ibuprofen or acetaminophen are 2 common medications to send with your student, and then also a thermometer. Okay, so some other tips. Definitely your students need their insurance, as I mentioned in the previous slide. So having a copy of their medical insurance card as well as their prescription benefits card is really important. So I would suggest making sure that they just have a picture of it, the front and back, so they know the numbers that they can call. This is an easy way for them not to lose it because sometimes they don't bring their insurance card with them. It's also important to check with your provider to make sure they have coverage here in Ann Arbor at UHS. And if not, you may want to ask them if they have any out-of-area waivers. If there are any gaps in insurance, I would highly recommend our student health insurance plan. We are still waiting for the final cost, but it will be around $2,300 per year, and it's very, very comprehensive. We also can help students with Medicaid applications if that's something that they need. Talking with your student about how insurance works also really helps them, and make sure that they are knowledgeable about the cost of any services that they might be requesting or getting. We do have a team here to help educate those students, but if they can come with some of that knowledge ahead of time, that really helps to make sure that they're prepared. As I mentioned previously, the patient portal is highly useful and something I would definitely recommend. And so this hyperlink here is how you can sign up for it. Okay, so we wouldn't be a good medical office without forms. Not too many, but just some things to send here. One would, and all of the links are right here. Our immunization records are incredibly important to have. If we know if a student is vaccinated, then that can help us make a decision on whether or not we have to worry about them getting sick from any exposures, and we can give them the proper advice. And if they need any treatment related to those exposures, then we would be able to make that decision quickly and not have to have delays until we got the immunization records. As I mentioned previously, it's important to have a consent to treatment form signed and also have their COVID-19 vaccine record uploaded. It is ideal to have all of this information at least 30 days before classes begin. In this way, we are able to upload this information to our systems so that as clinicians, we have access to the information. As far as mental health, coming prepared is also really helpful. So I think that there is a lot of awareness among our students and our population about the importance of mental health, and that can be a challenge as you're transitioning to college and to our campus. So coming ahead of time with resources and a knowledge on how to access those resources can also be really helpful. So we provided 2 different links with resources for mental health and for stress relief. If you need to send any health records here, we've provided that information, and then we have different contact information for us. And again, here is the hyperlink for our slides. Thank you so much for your time. I think there have been some chat entries by our team with some helpful links for you, and we're happy to take any questions that you might have. Jason, while we're waiting for any questions, are there any highlights that you would provide to our parents as our students, as they prepare to send their students here?
The only thing I would add is make sure that as you get the immunization records, you go to the hyperlinks that are available in the web presentation that will be available in about a week. That will allow you to upload any immunization data. That's helpful for us to have if your student should be seen here. For example, if they've cut themselves, to know when their last tetanus booster was. Also to make sure that they're up to date on any vaccines as they come in to see us. During their health maintenance exams, when we have that immunization data available, we do like to make sure they are caught up on their vaccines. And in the health kit, the thermometer is extremely helpful for us to have, because when your student's calling asking for advice, our answers to them might change based on if they're having a fever or not.
Thank you. So we have some questions here. I'm going to answer the first question, and you, if you want to type in some of the other ones, or we can chime in with answering. So we had a question, what is the process if a student is COVID positive? So that's an important question. If a student is positive, there are different routes that might happen. If they're tested here at UHS, then we will call them with the result. We will go over all of the information. So talk about their medical concerns, any symptoms that they might be experiencing, any questions they might have. We make sure that they have a place where they can have their own bedroom and their own bathroom. So for any of our residential students who are not having their own bedroom and bathroom, which is the vast majority of our freshmen, then we provide their isolation period. So we go over that with them. The guidelines have obviously continued to evolve. So we go over the current guidelines for how long that isolation may be, how to properly isolate as far as wearing proper masking, and we go over reasons that they need to seek care. We offer access to the MPOTA text messaging service. So if students would like us to reach out to them so that they have a way to to send messages to us, then we can do that as well. So we go over all of that information with them at the time. We also have contact tracing partners that we work with, and so they will reach out to the student and go over any potential exposures, and in that manner be able to take care of others who might need testing related to that exposure. As far as dental care, we do not have dental services here. We do have a dental clinic right next door. So if students would like to see the dental clinic team, they can. We can also, of course, provide information, or they can look on their insurance for any local dental dentist that they'd like to go to. And I'll answer, let me see here. Jason is answering about how do we submit power of attorney, and what would be the difference between a power of attorney and the consent documentation. So the power of attorney is allowing someone else or designating someone else to be able to make medical decisions for our students. So that's different than a consent form, which is allowing exchange of information, or for us to send information to any person or to discuss the student's health care. Okay, and I think the question below, the question stems from a conversation I had with a friend who was a physician at a student health center at another top tiered institution, and was talking to me about this. I think those were related. Jason, did you have anything else to add about that, or those unrelated questions?
The question from the guest was, do we carry medications to treat, say, acute anaphylactic reaction while a patient's in the building, or a seizure or a heart attack? And we do have emergency policies and procedures in place, and we are all trained on how to use those medications to stabilize the student while we're awaiting transfer to the emergency department. If a student's having one of the statements was a heart attack or a seizure, we would stabilize them and transfer them to the emergency department for ongoing monitoring.
Yes, thank you. Okay, and so if the student has been seeing a mental health counselor but needs to establish a new counselor, do you offer counseling? So we do not have counselors at UHS. Our partners at the Counseling and Psychological Services have counselors there. And then if students need a local therapist for long-term counseling, then we can also provide them with a list of counselors who meet their specific needs and who are also accepted by their insurance, and from a travel perspective are also accessible to our students. Okay, so so I think related to the context of the question about consent and power of attorney was if they contract COVID and they're quarantined, if they're too tired or sick to make decisions for themselves, can parents step in? And so certainly having the power of attorney that's designated is helpful. If a person is completely unable to take care of themselves, consent is, we need to reach an emergency contact. So we are going to do that. We're not going to have a lack of a consent form that prevent us from helping to make the best decisions for our students. In those types of emergency situations, we would not then be overseeing the care. We would be most likely sending the student to the hospital. But certainly if there is a need for the parents to help making medical decisions, then having that consent and power of attorney both would be helpful. Thank you. These are important questions and ones that are really important to discuss. Okay. I think we are at time. So thank you so much for all of the questions and the interest. Again, our slides will be up by the end of the week. And of course, you can reach out to any of those contacts with further questions. Rest assured, we are excited to meet your student and take care of any needs and help them on their journey. It's an exciting time. So congratulations to your students and congratulations to you, because you have also been part of their journey, and we're here just as you have been all this time to support your students. So go blue and have a good rest of your summer.